Hello and welcome back everyone to another episode of Top Doc Interviews. My name is Dr. Derek Barron and I want to thank you for joining us today. Today we're talking about a very important topic, and that is how to find a great chiropractor online. And today we're very fortunate to have Dr. Don Lavanga of Lavanga Chiropractic in Feasterville, Pennsylvania. Dr. Lavanga, thank you so much for joining us. If you don't mind, would you give us just a bit of background on yourself and your practice?
Thanks for having me, Dr. Derek. I've been in practice in the Philadelphia area of Feasterville since 1987. I've seen a lot of the transitions in chiropractic during that time, and we've gone from the snail mail to internet to now to social media, and I'm excited to do a little conversation about the best ways to use the new technologies.
Well, fantastic. Thanks again, Dr. Lavanga, for being on the show with us today. We truly appreciate it. So the first big question I want to get to today is, how do you find a good chiropractor, especially online? So as a leading expert in the field of chiropractic, could you give us maybe 2 or 3 tips on the best way to find a chiropractor online?
Okay, so if we're searching online, even in the days going by when word of mouth was the way people found a good chiropractor, where we are now, that even if someone mentions your name, they're going to go check you out on the internet. So the best way to find someone is to go online and see what their reputation is, see how they're perceived online, check their reviews, are there testimonials, and then obviously move next to their website. You want to see how are they presenting themselves. What's the information? Is it a 1991 website, or is it a 2014 website? Look at different reviews on there, and you may even be lucky enough to have even almost a conversation with the doctor. They may have some video of themselves, sort of what we're doing right now, so you can actually have a personal meeting with that person by hearing them speak and having them tell you exactly what you're going to expect when you come to their office.
Well, that's excellent advice. I really like the part when you say that patients should go online to look for reviews and what your reputation is. And specifically, I've gone to your website. You've got an incredible website, and there's a tremendous amount that people can learn from, because it's always very easy for you or your staff to speak highly of yourself. But when you have patients that have gone through your care plans and they've gotten phenomenal results and they go online and speak about you, that's the best way for somebody to really get to know you before potentially entering the office. So again, thanks for that great information. So go ahead, Doc. Go ahead.
Well, I think that if we're gonna, doctors are looking for a good client, good patient, patients are looking for good doctors. So with the advent of technology now, we can use that technology to actually, become part of that practice or get to know that person before you actually even walk in the door. And I always say you should call and ask for a complimentary consultation, just to meet the doctor, see the office before you invest yourself into that practice.
Again, more great advice. I couldn't agree with you anymore. So that leads me into my next question, Dr. Lavanga. If someone was looking for a chiropractor in the Feasterville, Pennsylvania, or the greater Philadelphia area, and they came into your office, what type of an experience could they expect to receive?
Well, for the past 27 years, the first contact with us was the telephone. Now we have people who are going to search us online, but ultimately, even if they make an appointment online, we're going to call them on the phone. So before you enter my office, you're going to meet somebody on my staff. And what we like about that is that we get a lot of information, give you information, make sure you have you know how to find us, and you're comfortable, so that when you walk in the door, you're already essentially a part of our practice, because you're looking for Nancy or Ali or Kim. You're looking for one of the people that you spoke to on the phone to guide you through the next step, which is always a little tough going to a new practitioner or going to a doctor in general.
I really like that. It sounds as though in your office you add an extremely personal touch, even before they put or step foot in the door, and that's great. That's something that prospective patients really need to hear and understand. So, Dr. Dan, regarding your particular expertise in chiropractic and the wellness field, how does your practice differ from others in your area?
Well, Doc, we like to think that over the years, having integrated different things, there's a lot of practices that and I speak to a lot of chiropractors who have integrated a lot of different modalities into their practice: massage, nutrition, wellness care. There's a bunch of different things that are out there for people to really help them. What we think that we've done is we've established something we call the Circle of Wellness system, that we bring patients into a system so that we slowly, piece by piece, guide them through what's available to them in the practice, starting with an assessment that it'll take to see how proactive are they in their wellness strategy. So we tend to think that we've taken what's out there and we've put it into a system so that when you come to see the chiropractor, you're going to understand completely what's offered, what's available, what the process is going to look like, how much is it going to cost, and it's a complete system.
It sounds like this Circle of Wellness is a component that when you walk in your doors, they go through an evaluation with you, you help them understand where they're at today. And then you give them some growth pattern is where they're, it's a growth pattern together where you can help them achieve the success in health that they want and even in other life components. Is that true?
Absolutely. Look, when a patient comes to my office or any doctor's office, the patient has a goal. That goal may just be to get that pain out of my back today, or that goal may be that they're looking for health and wellness. Well, that's inherent upon us to discover what it is that they're looking for. And so how we do that is we, besides having intake forms and finding information and doing a health history, we also do an assessment as to where they are in their health paradigm. Then we use that assessment to make our diagnosis and also to make our recommendations for future care. And then we agree upon with that client what the procedure is going to be. Along the way, we reevaluate. Usually every 6 to 12 weeks, we'll do a reevaluation and reassessment to see where have we gone to, have we grown, have we gotten better, how are we performing.
Well, excellent. So I'm excited for some people to come in and see you, after they watch this video. So I know when we spoke earlier, there are some very special things that you do in your office for new patients. Could you share that with us?
Absolutely. We like to start, when we look at the circle, our Circle of Wellness, and you see it as soon as you walk in the door, it starts obviously in my office with the chiropractor. So my job as a chiropractor, really, DC, doctor of chiropractic, is really doctor of cause. So my job is to find out what is the cause of the problem. The next thing we move on to is whether it's a massage or physical therapy, but some sort of therapy that's going to help with the treatment, with the adjustments, if it's necessary. Then we'll move into the chemical portion of what people are going through and experiencing, depending on, do they take vitamins? Are they taking vitamins currently? How is their diet? Because the chemistry is very important in what they do, and in some instances, we're going to recommend a cellular cleansing or detoxification program, if necessary, before we start recommending lots of vitamins, which can become costly after a while. And finally, we move through, and through the history, we'll discover, some people may come in and they have been, traumatized. Maybe it's a car accident, a work injury, or maybe there's some other kind of trauma going on. So we always look at the stress level of the person. So we address the mental emotional aspect by looking at the stress level. Is the person goal-oriented? And we try to take them through a complete analysis of where are we starting from. Do they have a history? Do they have a history of cancer? It's very important to understand where that person came from. And then when you make your diagnosis and when you make your recommendations, we address all those areas. Now, every person doesn't have to go through every part of everything that we do, but we make available to them the things we think are important. And then in many, many, many cases, people will say, you know what, absolutely, I need to start eating better, besides doing the treatments that I need to make my back feel better.
Well, what I think is incredible about this is it sounds like it's a personalized plan, especially with the Circle of Wellness. So the viewers that are watching this, Dr. Dan, if they're interested in taking you up on this offer, how can they get a hold of you?
Well, the best way to get a hold of us is the good old-fashioned phone, 215-364-1112. We're on the web, and our webpage is Lavanga, Lavanga, chiropractic. You can get in touch with me personally through email. It's drdan, Dr. Dan, at drlavanga, thelastname.com. So any of those three methods you can get to me.
Well, Dr. Dan, it's been a great pleasure talking with you today. And, if there are any of these patients that are watching this in the Feasterville, Pennsylvania, or Greater Philadelphia area, and they're looking for a chiropractor, make sure to look up Dr. Dan Lavanga and Lavanga Chiropractic. And I want to thank you all again for watching, and stay tuned for our next episode where you'll bring you continued advice and healthy living tips from another top doc.
Derek, I want to thank you for doing this interview, because it's folks like yourself who are using and helping us use the technology to reach out to people. And that's really the most important thing we need to do, is to tap into the resource of helping people find what they need. Thank you.